It's of interest to Georgetown University that this topic, which relates to the full dimensions of both the discovery and the clinical application of a vaccine against human papillomavirus, motivated not just our own scientific, ethical interests, but there are much broader issues that will be discussed today.
Worldwide, cervical cancer is a huge problem, and you probably all know it's HPV is involved in all cervical cancers. In the beginning, we thought maybe it was a subset, but now we know that it's in all cervical cancers. And you probably all know that HPV is the most frequently transmitted sexual disease.
There are only 3 cancers. We just did a cancer issue of JAMA, and we had all kinds of things, discussions with the National Cancer Institute, some of the top investigators in cancer. There are only 3 cancers that have substantially been decreased in the last several decades. One is leukemia in kids, thank God. One is lung cancer. Why? Smoking. And it's mostly in men. It hasn't gone down as much in women because women still are smoking.
Do different communities, different demographic communities, different ethnic communities need, in order to believe what you and I already have trust in, that if the science is really peer-reviewed and demonstrated, can't we just move to it? It turns out not so fast. It had an implication in especially the African American community in terms of trusting this message. And an earned mistrust, I have to say, that goes back with the sort of history of medical intervention in that community.
And it costs roughly $400 to administer this vaccine. At least that's the price that it's being sold for. So we're talking about basically paying about $1.2 billion.
And I will just conclude with Kathy's point, and I think it's true for physicians, the need to take back the ownership and to be responsible and fully conversant with one's patients and all the communities is essential for the profession.